there's probably no better guest to have on related to healthcare technology, um, because you are the head of HIMSS, which has 120,000 members, I believe. I mean, the HIMSS name is iconic within the whole healthcare technology space, and just the sheer volume of people surrounding this organization is incredible. Um, so maybe for the benefit of our audience, tell us a bit more about yourself, how you came to HIMSS, and then how you decided to take the leadership position with the organization.
Oh, wow. Well, first of all, thanks again for having us on. And HIMSS is growing like crazy. In fact, we literally just broke 130,000 members in this past month as we've been adding in from all corners of the world with significant growth internationally as well as here in North America. So we're very proud of that. I think, for me, I've been in technology for many years. And when I came into healthcare about 22 years ago, I looked around at various organizations as anyone would walking in, and HIMSS completely resonated with me. And it resonated because it's not an association, it's a society. It really reaches out across the full spectrum of the healthcare ecosystem. It involves everything from physicians to technologists to nurses to informaticists to government policy, workforce development, and then really develops a lot of tools using all of these members' input as to what works, what doesn't work, or at least the experiences that can be shared. And it's just an incredible aggregation of individuals, not just globally, but also within their regions and their chapters. So for me, walking in as a bit of a change junkie and coming from some super advanced backgrounds, including the development of video on demand and the utilization of e-business and how to leverage the internet and all of these different functions, which I was really fortunate to be on the edge of. Walking into healthcare and seeing all the potential that health has to offer, in terms or needs in terms of its overall um, desire to get better and utilize technology and utilize tools, but more importantly, the information that the technology derives. And so this kind of just got back, to the vision of HIMSS, which was to realize the full health potential of every human everywhere, and the fundamental mission, which is to reform the global health ecosystem through the power of information and technology. And I think that that's the biggest difference because it's not about IT. IT is an enabler. AI is an enabler. And so when you have an opportunity to go into healthcare, and just that whole global ecosystem, if that doesn't wake you up in the morning and get you going, then you know, don't come because because you really need it every single day. And it makes a difference.
I'm curious when you first joined, like more formally joined HIMSS as the CEO. Um, what were some of the things you saw that you felt could really continue to help propel the organization? And we could do like a then and now type of thing. Like,
Yeah.
what now are you most focused on?
Well, I mean, look, we always stand on the shoulders of the people that preceded us. So I was fortunate enough to be on the board at HIMSS for 4 years prior to taking the CEO role.
Mhm.
So I had some insight into what HIMSS was capable of being. And I think we were extremely well known, and we're still well known for our global conference for sure. But I think that what I saw personally were two areas that were really ripe for development and need in globally. One was taking our maturity models, expanding them, modernizing them, not to be a technology checklist, which they largely were, and what a lot of other certificates are, but really, how do we impact from a strategic standpoint and operation standpoint in order to improve access and improve quality?
Hmm.
I came out of hospitals. I came out of developing products and services for use in the care and the provider side of the market. So My ideas, which dovetail perfectly into where HIMSS was and capable of going, was really how do we do that? How do we bring to bear the information that is just sitting there with golden nuggets? It's been there since the organization was started in 1961. A number of computer scientists getting together and saying, "Hey, if we played with this data, maybe we could get some really good insights into healthcare." I know, crazy talk, 1961. So that was a big part of it. The second part for me was we had this. I worked internationally prior to coming into HIMSS. I worked globally, both when I was at my provider that I worked with, Kaiser Permanente. I worked globally as a senior advisor as McKinsey. I worked globally with the Chartist Group, but I was fortunate enough to lead digital transformation and health and the genomic practice. And what I saw was this demand globally. And so when I came in at that time, less than 5% of our membership was outside of North America. And today, 40% of our membership is outside North America.
Hmm.
And so we've grown, extensively on an international basis. While we've continued to grow in North America, you could argue, we're really well penetrated, right? Over 80,000 members here. But the growth has been in Europe, it's been in Asia Pac, it's been in India, it's been in the Middle East. And the demand, our biggest challenge right now is keeping up with Latin American demand, demand that's coming out of Africa. And we're in the process of expanding in those areas. But when we do it, we need to do it with the right boots on the ground, if you would, the right language, the right people. It's not about dropping in, doing an event and flying out. We're not that. We participate in that, but where we really excel is having the meaningful conversations, the thought leadership, understanding the local needs. And look, we're all solving the same problems, but everyone's at a different life cycle.
Mhm.
So that's what I saw. And it was built into the system. Passionate followers of HIMSS everywhere, and given the permission to build their communities and grow, they've been doing that. And I think more than anything else, just lending the permission to make sure that we can support internationally and grow, and that's what we've been able to do.
Mhm. And is that currently, so today it's also about international expansion, growing those markets?
It really is because when you look at some of the centers of excellence in the world, Samsung Medical Center in Seoul is probably the most advanced technologically and information based medical center in the world.
Mhm.
They have four stage seven, which means four out of our eight maturity models are at their highest level of an eight stage, 0 to 7. We have a lot to learn from what's going on in Seoul. When you go into Taiwan, when you go into Australia, when you go into Indonesia, there are pockets, and just using Asia Pac as an example, of some amazing excellence and innovations.
Mhm.
And we need to learn that in North America to understand what's occurring. When you look at what's happening in Europe and how they've learned from North America what we did well, what we didn't in meaningful use. And as they're rolling out EMRs, we're doing large scale programs in Germany and Italy and Portugal and Romania, et cetera, because we're helping countries roll out. Well, that's a different approach. So has
Mhm.
anyone done this before? Right. So leaning into that and being able to participate and give guidance when asked and to be able to lend support and thought leadership, it's an amazing opportunity to contribute. And look, in the end, healthcare and health ecosystem, it's about contributing.
Mhm.
It's about making just a little difference. You don't have to make gigantic differences to have long-term impact. Just a few things, and that vector over time keeps growing, and you can have a profound impact on the people that we're serving. And in the end, it gets back to that individual to realize their full health potential.
You've had a very successful career, which continues to go on. How has your thinking about leadership evolved? Presumably you were at one point a young leader, just learning how to really manage and inspire organizations. Now you're at the top of a very big organization, a large and growing membership. How do you think about leadership?
It's situational. I don't think that one formula ever fits all. I've been around some really great leaders in my day that I've learned from, mentors, and they all have very different attributes because they were. Sometimes they say that the times makes the person doesn't make the time, and I think that's true. I think innovation is critical in leadership. I think it's a hard mix between the flexibility at the individual and the leaders within your organization's level to be creative and do new things. And then at the same time, from a leader and anyone who's run a company, keeping it within the bounds of what you can and cannot do, right? The sky's the limit. In our family, we used to make a joke, say the sky's the limit and 495 is the sky, right? So how do you really maximize it? And I think where I've changed from a leadership standpoint is like any pendulum. You go from setting example, and you try to lead by example always, and then finding lots of people who are smarter than you, um, and give them the freedom to do what they need to do. But you also have to be a partner to make sure that they're within the parameters that will both make them and the organization successful at the same time.
Mhm.
'Cause you do have each organization has a unique footprint. Anyone I've ever been in, they have a unique history, and no one starts from the same place. It's just like a hospital. The old expression, if you've seen one hospital, you've seen one hospital.
Mm.
And so you have to look at each situation you're in. And so we've changed at HIMSS quite a bit. We've gone from, I think in the early days when I came in, totally wrapped around the global conference as our main focal point. And today we're focused around our membership and the growth of our membership and the support of our membership and the improvement of the individuals and the organizations within our membership. And we express those capabilities through channels. Conferences are one, media is another, our communities that we talked about earlier is another. And so I think you make adjustments. And so I would say the greatest attribute you can have as a leader is don't be afraid to change. Don't be afraid to basically listen to the opportunities that are there. And don't be afraid to say no either. Um, but remember, you're also creating leaders behind you
Mm.
because no matter what you do, you're going to ride off into the sunset. And it's really important that the people behind you have the same tool set that you were given when you're coming up. So it's fun being a leader.